COVID cases and hospitalizations are once again on the rise across the country as winter weather drives people to gather indoors. New COVID hospitalizations topped 34,000 for the week ending on December 30th, according to the CDC. That's a 20% increase over the previous week. The agency says a new variant of Omicron is responsible for up to half of those cases. Let's bring in Dr. William Schaffner. He's a professor of infectious diseases at Vanderbilt University Medical Center. Dr. Schaffner, always good to have you with us. So I got to ask for some perspective, because when we hear these numbers, tens of thousands of new hospitalizations, it sounds substantial. Let us know, where are we as a country right now in terms of battling COVID?
Well, Lana, I think substantial is a very good word. You know, it is winter. Here we are in January, and it's winter respiratory virus season. COVID, along with influenza and RSV, is on the rise throughout much of the country today. And apropos of COVID, we're seeing an awful lot of mild infections. That is, they don't require hospitalizations, but you can feel miserable for 3 or 4 days, that are being caused by this JN.1 variant. However, it's not causing more severe disease, and also the currently available updated vaccine still provides protection against hospitalization. But with so much widespread illness, it's going to find older people, people who are immune compromised, people who have underlying chronic medical conditions, and those are the folks we're seeing who currently are requiring hospitalizations. Our cases that have required hospitalizations in my neck of the woods have been inching up since December.
Well, you mentioned the JN.1 variant. I understand that up to 50% of the new COVID cases are related to this variant of Omicron. What are some of the signatures of this variant of JN.1? Talk to us about the risks.
Well, JN.1 is, you can think of it as a grandchild of the original Omicron strain. You know, these viruses like to mutate. And its distinctive characteristic is that it is contagious. So it's spreading very, very widely. And as such, it's finding people who are more susceptible, including those people who have not yet taken advantage of the current vaccine. And you know that the acceptance rate has been very low. But in and of itself, it's not, fortunately, producing more severe disease. And fortunately, yes, that vaccine still is providing protection, particularly for high-risk patients, in keeping them out of the hospital should they have received it.
So you mentioned that the acceptance rate of vaccines now is fairly low. Where are we in terms of the vaccine rate in this country?
At the bottom, 20% or less. So if you haven't been vaccinated, please run this afternoon. Take advantage of the vaccine.
All right. Dr. William Schaffner, thank you for joining us and for all that you do.
My pleasure.